Hi guys, I'm Dr. Ruby Sehra, um, consultant gynecologist of Sehra Medical Center and head of the department of Sri Balaji Action Hospital at Paschim Vihar. Today I'm just going to talk about postmenopausal bleeding. Postmenopausal bleeding means any abnormal bleeding once you've finished your periods. That means you've stopped having your periods, but after 6 months you again start having bleeding. This is an abnormal bleeding. This can be cancerous or non-cancerous. It can be because of the just endometrial hyperplasia, that is thickening of the uterine lining, or it can be because of the polyp, that is an extra growth, which could be cancerous or non-cancerous. I don't think that you should take it lightly. The incidence, you must be knowing that it is around every 4 to 5 women after 50 years of age. In 1 lakh women are suffering from this cancer, abnormal uterine cancer. This cancer has become little less in incidence because of the early diagnosis. So I suggest you to not ignore the symptoms of abnormal bleeding after 50 years or your menopause and get yourself investigated the earliest possible. Immediately consult your doctor, get investigations done, get all the procedures, small procedure done, and get your surgery done, because this is the only cancer which gives us an indication at an earlier stage. But if we don't listen to it, or if we don't pay attention to it, then we are going to land up in a big complication. Endometrial cancer is thickening of the inner lining of the uterus, that you can see here that this is a uterus, this is a growth in the inside the cavity of the uterus. This can be here in the cavity or in the lower down. So once you have abnormal bleeding, the other symptoms can be that you are having a foul smelling discharge. Then the chances of having a cancer are high. If you during in the past, if you have had high heavy bleeding, polycystic ovarian disease, or you had any estrogen dependent medicines you've taken, and you have diabetes, and you have hypertension, then you are all the more at more risk of the endometrial cancer. Once you had this cancer, the myths are that it will go away, don't worry about it. But no, this is an indication God is giving you. Take an appropriate action at an appropriate time so that you don't land up in big complications. How? You should go to the doctor. That's why, the screening is done to know it earlier. Once you know it earlier, there are good chances that you will not have any other problem. Once you have had this problem, then you should go to the doctor. Get your ultrasonography done to know how much thicken is your endometrium, and you should get your pap smear done. If advised, you may have to undergo MRI also. If your endometrial thickening is more than 4 millimeter, it is definitely an indication to undergo a surgery. And surgery is quite easy, and it is just consists of total abdominal hysterectomy or laparoscopic hysterectomy with bilateral salpingo-oophorectomy. But the recovery period after total laparoscopic hysterectomy is just a week or 10 days, and you go walking on the third day of the surgery, and you are self-sufficient, you can take care of yourself, you don't need anybody's help. But the only thing is that you have to be in time. In case the growth has spread in the various adjacent organs, then we have to go for a bigger surgery. Once you've gone to the doctor, you've got your DNC done, your hysteroscopy done, and the ultrasound, that the biopsy report says that it is a cancer, then you should get your hysterectomy done immediately and without any delay, so as to get a good success rate of survival. Chemotherapy and other things are really painful. So in case it is detected earlier, then you will not have to undergo this chemotherapy and radiation, and you will be taken completely care of. Thank you so much.